As fungal pathogens emerge from the shadows, they are sparking new health challenges across the globe. From Candida auris in hospital corridors to Trichophyton spreading in unexpected ways, these infections are growing in prevalence, resistance, and impact. This video delves into the latest on these silent invaders, how they spread, resist treatment, and demand innovative control measures to combat rising morbidity and mortality. Discover the urgent need for awareness, advanced diagnostics, and new therapies in the face of these formidable fungal foes. The threat posed by emerging fungal infections has escalated over the past decade, fueled by environmental changes, human activity, and a rising population of immunocompromised individuals. These infections, often overshadowed by bacterial and viral pathogens, are now recognized as serious health challenges with rising morbidity, mortality, and prevalence worldwide. This presentation provides a comprehensive overview of the clinically important emerging fungal pathogens affecting humans, animals, insects, and plants, focusing on their epidemiology, transmission, diagnosis, treatment, and public health impact. Overview of emerging fungal pathogens. Infectious fungi have traditionally impacted individuals with weakened immune systems. However, increasing numbers of emerging fungal pathogens are now affecting diverse populations, including immunocompetent individuals, animals, and even entire ecosystems. Recent examples include Candida auris, Aspergillus fumigatus, Trichophyton mentagrophytes genotype 7, TMVII, and Cryptococcus neoformans. These pathogens bring unique challenges, from drug resistance to novel transmission routes and complex environmental influences, underscoring the need for global awareness and preventive measures. Key emerging fungal pathogens of clinical concern. Candida auris. C. auris is a multi-drug-resistant yeast that has rapidly spread worldwide since its discovery in 2009. It poses significant risks in healthcare settings due to its high transmissibility and persistence on surfaces, often causing severe bloodstream infections. The fungus demonstrates resistance to azoles, echinocandins, and, in some cases, amphotericin B, resulting in mortality rates ranging from 30 to 60% in critically ill patients. Controlling C. auris requires stringent infection control measures, including isolation protocols and rigorous cleaning practices. Aspergillus fumigatus, a mold species commonly found in soil and decaying vegetation, causes invasive aspergillosis, especially in individuals with compromised immune systems. This pathogen is also increasingly resistant to azoles, often linked to the use of agricultural fungicides. Invasive aspergillosis has a mortality rate exceeding 50% among vulnerable populations. Control and treatment are complicated by limited effective antifungal options, and the resistance problem continues to grow. Cryptococcus neoformans and Cryptococcus gattii are encapsulated yeasts that cause severe infections in both immunocompromised and immunocompetent individuals, with Cryptococcus neoformans particularly affecting those with HIV/AIDS. Cryptococcus gattii has expanded into regions previously considered non-endemic, such as the Pacific Northwest. Both species can cause cryptococcal meningitis, a life-threatening condition with high mortality rates, especially in resource-limited regions where advanced diagnostics and treatment may be unavailable. Recently identified as a sexually transmitted dermatophyte, TMVIU affects the groin and genital areas presenting as itchy, scaly lesions. Transmission primarily occurs between sexual partners, marking TMVIU as one of the first fungal pathogens associated with sexual transmission. TMVI infections are challenging to treat due to emerging resistance to common antifungals, and the infection may be misdiagnosed as a bacterial sexually transmitted infection. Diagnosis and management require accurate molecular testing and awareness among clinicians to avoid inappropriate treatments. Emergomyces species. A genus related to Histoplasma, Emergomyces species causes emergomycosis, a life-threatening systemic infection, especially among immunocompromised populations in sub-Saharan Africa. Emergomyces africanus is the most prominent species, causing skin lesions and pulmonary and systemic infections. Mortality rates are high without prompt antifungal treatment, though diagnostic options are limited in many affected regions, posing a significant public health challenge. Mucormycosis, often termed black fungus, is caused by a group of fungi within the order Mucorales. This devastating infection affects the sinuses, lungs, brain, and other body parts. It gained attention during the COVID-19 pandemic, particularly in patients with uncontrolled diabetes. Treatment usually requires high-dose amphotericin B and surgical debridement, as it rapidly spreads and causes extensive tissue necrosis. Mucormycosis is difficult to treat, with high morbidity and mortality rates, and the need for combined surgical and medical intervention complicates patient outcomes. Cordyceps species known for their parasitic life cycle, certain cordyceps fungi primarily affect insects and arthropods, disrupting local biodiversity and ecological stability. Although cordyceps infections in humans are rare, the environmental impact and effect on ecosystems raise indirect health concerns. Studies into this genus have expanded, though infections remain largely confined to their traditional hosts. Coccidioid species, commonly known as valley fever, is endemic to the southwestern United States and parts of Latin America. Climate change has been linked to its expanding range, resulting in more cases among individuals exposed to dust and soil. Symptoms range from mild respiratory illness to severe disseminated disease, particularly in immunocompromised individuals. Valley fever cases are rising, making it essential to understand environmental and climatic factors contributing to its spread. Fusarium species are highly resistant fungi that can infect both immunocompromised individuals and agricultural crops. In humans, Fusarium species infections can lead to severe disseminated disease, especially in patients with weakened immune systems. In plants, Fusarium contributes to significant agricultural losses, affecting global food security. Resistant to most antifungals, Fusarium presents unique challenges for both clinical and environmental management. Each fungal pathogen has a distinct epidemiological profile and transmission mode. In healthcare settings, Candida auris thrives in healthcare facilities, spreading easily on surfaces and medical equipment. Environmental molds like Aspergillus fumigatus, coccidioids, and Mucorales primarily enter through inhalation, affecting the respiratory system. Dermatophytes like TMVI spread via close contact, including sexual transmission, highlighting a new avenue for fungal infection spread. Agricultural practices, including fungicide use, impact fungi like Aspergillus and Fusarium, driving resistance development. Morbidity, mortality, prevalence, and incidence. Fungal infections are associated with significant morbidity and mortality, high mortality rates. Infections such as invasive aspergillosis and cryptococcal meningitis often have mortality rates exceeding 50% in immunocompromised patients. Prevalence and incidence trends. The incidence of Candida auris has spiked worldwide, while mucormycosis cases surged during the COVID-19 pandemic, particularly in diabetic populations. TMVIU is underreported due to misdiagnosis and stigma, suggesting a need for better surveillance. Accurate diagnosis of fungal infections is often challenging due to subtle symptoms and the overlap with bacterial or viral infections. Molecular diagnostics, like PCR and next-generation sequencing, are increasingly used for accurate and rapid identification, especially for resistant species like Candida auris and TMVIU. Antigen and antibody testing are used for infections like cryptococcosis, though sensitivity and specificity can vary based on patient condition. Traditional methods like culture and histopathology, while still valuable, are slow and may be less effective in detecting fastidious fungi or resistant species. Treatment of fungal infections is challenging due to limited drug options and rising resistance. The three main antifungal classes, azoles, echinocandins, and polyenes, are increasingly ineffective against resistant strains. Pathogens like Candida auris, Aspergillus fumigatus, and TMVI show resistance to azoles and in some cases echinocandins, limiting treatment options. Newer agents such as rezafungin and ibrexafungerp are in development and may offer broader spectrum activity against resistant fungi. In invasive infections like mucormycosis, surgical intervention is often necessary to remove infected tissue, adding to treatment complexity and cost. Preventive measures are essential in managing the spread of emerging fungal infections. Strict disinfection and isolation protocols are crucial in healthcare settings to prevent the spread of Candida auris. Filtration systems in hospitals can reduce airborne fungal spores, while controlling azole use in agriculture may limit environmental resistance development. Educating healthcare providers on recognizing emerging fungi like TMVI and improving diagnostic capabilities will aid early intervention and containment. The rising prevalence of emerging fungal infections underscores the need for global awareness and coordinated public health responses. With high morbidity and mortality rates, limited treatment options, and increasing antifungal resistance, these pathogens pose complex challenges. Enhancing diagnostics, developing new antifungal agents, and promoting infection control practices are vital steps toward managing this growing threat. Awareness of diverse fungal pathogens including Candida auris, Aspergillus fumigatus, TMVI, and others is crucial for healthcare professionals and public health.